Hello, we are Group 6. My name is Katie. This presentation is also brought to you by Christy, Arlisha, and Lakeisha. We will be going over the Institute for Healthcare Improvement, which I will be referring to as IHI throughout this presentation. The IHI is a nonprofit organization that has started in the 1980s, but it was not officially founded until 1991. This group was founded by a group of like-minded individuals with the same goal, which included Dr. Don Berwick and Paul, I'm probably butchering it, but it's Batalden, I think. Purpose and mission. Purpose, it was established to bring the science of improvement and quality management principles like those used in manufacturing companies to healthcare and reduce harm, waste, and air. Mission statement. While the exact wording may have changed slightly over the years, their core mission is to improve health and healthcare worldwide. They do this by focusing on continuous learning, spreading successful improvement methods, and developing new ways to solve intractable problems in health and care.
Please enjoy this video.
Finally getting a grasp on everything IHI does. It starts with a small group of dedicated people, a concept we call One IHI, and a big mission to improve health and healthcare worldwide. For more than 25 years, we've partnered with organizations, communities, leaders, and frontline practitioners around the globe to spark bold ways to improve the health of individuals and populations. IHI is the first place to turn for help for anyone, anywhere who wants to change health and healthcare for the better. I work as one of our leads in patient safety, but that's just one of our 5 focus areas. We work on building improvement capability, achieving better value in healthcare, helping to make care more patient and family-centered, and championing the triple aim of better health, better care, and lower costs. Year-round, we offer exciting programs and education, some free, some for a fee, some live, some virtual, in these 5 areas. I'm partial to our patient safety executive development program that we offer in the spring and fall, but all of IHI's offerings are high-quality, innovative educational experiences that will enrich your professional life. You can find the full list of programs at ihi.org. We work all over the world too, with conferences and collaborations in North America, Latin America, Africa, Europe, the Middle East, and Asia. After all, you can't improve health and healthcare around the world if you don't have a global focus. We're thrilled to have you, and I hope you'll spend a couple minutes on ihi.org. Click around, explore, and let us know how IHI can help you on your improvement journey.
Regulation, discipline, and enforcement. No, the IHI is not a regulatory body and does not set mandatory standards that carry legal or disciplinary weight. It is an independent, nonprofit organization that is focused solely on education, collaboration, and improvement of science. Therefore, there is no discipline involved for not adhering to any of IHI's recommended practices, models like the model for improvement or the triple aim, or any of the safety standards. Consequences and disciplinary actions. Since the IHI is not a regulatory body, questions about consequences and disciplinary actions for noncompliance are not applicable. Facilities are not penalized by the IHI. However, hospitals often adopt IHI's framework. Examples are the Global Sepsis Initiative or Project ECHO. Because they are internationally recognized as best practices for safety and quality. Failure to follow these practices could still result in poor patient outcomes and potentially lead to disciplinary actions from actual regulatory bodies like the Joint Commission or state departments of health.
Survey frequency. This question is not applicable as the IHA does not conduct regulatory surveys. They may conduct site visits for research, educational programs, or quality improvement projects, but these are voluntary and non-regulatory. Participation, focus, and standards. Is participation with this agency mandatory or optional? Participation with the IHI is completely optional and voluntary. Where can you find the nursing standards of care? The IHI does not publish mandatory nursing standards of care. For more information on the IHI, you can visit their website, ihi.org, or visit YouTube and search their videos. Participation, focus, and standards. Instead, they provide quality improvement methodologies, change packages, and best practice guidelines that can be used to improve how a facility meets mandated standards set by other regulatory bodies, such as the State Board of Nursing or the Joint Commission. For mandatory nursing standards of care, you must look to the State Board of Nursing and federal accreditation agencies like the Centers for Medicare and Medicaid Services, CMS, or the Joint Commission. Focus. Quality improvement versus enforcement. The IHI is primarily focused on quality improvement. Here is a video from the IHI, Why Nurturing Quality Improvement Matters.
What we know about central lines or bloodstream infections is that the dressings are essential, and it's very important that they stay clean, they stay sterile, but also that they're changed appropriately. So if you're if you're a leader working on that team, a way to do that is to you could have a meeting. Here's what we need to do. We need to figure out a process to where these dressings get changed every 7 days, day or night. They've got to get changed. And you throw that out to the group and you say, go forth and do this. And go do this. And let me know how it's going. And so without that nurturing, good-hearted, wonderful people may go try a bunch of things. They may be frustrated because they don't know what they can try, what they should try. They may go back to a staff meeting in that unit and say, you will change dressings every 7 days, the end. And then it just kind of dies there. And so you look at data a month or two later as a director or a leader, and you say, well, we had a couple, it went down a little bit, or we had a couple of weeks there where things were okay. Well, as opposed to really trying to nurture that process, a new process as a leader, understanding the change process and what's going on in people who have been doing central line dressings for years and years, understanding that they need to understand that vision. They need to, it really is a conversation about what it is we want for our patients. So as you begin that process, ask them how they do it now. Ask them what the failures are now. What keeps us from getting that done? And then as you think about tests, guide them through some tests. Could we use some sort of color-coded tape? Could we use some kind of flag on the chart or on the door or on the wall or on the bag? Ask them, and then as when they begin testing, then don't just see them at meeting time. Make sure, put it on your calendar to walk through that unit and say, I just thought I'd walk through and, tell me, you got a couple of folks up here with central lines, and just walk in so that you understand as a leader what a central line apparatus all looks like. I mean, sometimes as leaders, we get so focused on the outcome that we don't even understand what people are testing or what they have to do.
Quality improvement. The IHI teaches organizations how to improve through plan, do, study, act, or the PDSA cycle. With the central line dressing changes we just watched, that was the plan, and then they did it and studied it and then followed up with it. They have no enforcement or regulatory power. The gap regulatory agencies, CMS, or the Joint Commission, identify what the minimum standards of care is and enforce it. We appreciate your time as we have gone over this PowerPoint with you. Arlisha Owens, Lakeisha Woods, Katie Pilcher, and Christy Oliver.
Here are the references.